Your tabletop should have a smooth and easy-to-clean surface. Stainless steel or a laminated surface like Formica is best suited for this kind of service. With latex gloves on, spray your tabletop with Wavicide. You will do this before and after each piercing. Let the Wavicide stand on the countertop from 1 to 10 minutes. Then wipe and let air dry. Be sure to read the instructions for standing times. Place a polyback paper, like a lap cloth, on the newly Wavicide sprayed work surface. Next, place a 6-inch disposable paper dish, your sterile forceps, and needle, and your jewelry on your lap cloth. Place on the dish a tongue depressor or wooden stick and 3 cotton balls, if you are not using pre-soaked iodine wipes. Add your finger cots, rubber bands, and a receiving cork to the lap cloth. Some piercers prepare and use a receiving stick made of a wooden craft stick with Dermacell tape wrapped around the end of the stick approximately 15 to 20 times, as to create a soft bump to receive the needle. This can be very useful when doing a nose piercing. Prepare 3 or 4 paper towels for wiping by tearing or cutting them into quarters. The spray bottles of alcohol and green soap, as well as the Wavicide bottle, are covered with plastic bags, and the iodine solution is placed near the cotton balls. A small amount of bacitracin is removed from the tube and placed on the paper plate. The rubber finger cots are placed on the ring opening and closing pliers, then fastened with rubber bands. If the jewelry has not been autoclave sterilized, remove the jewelry from its bag and place in a plastic cup with an instrument germicide such as Wavicide. Soak for at least 20 minutes before inserting into the skin. When ready, be sure to wash with hot running water, shake off any excess water, remove the ball, and open the jewelry with the ring opening pliers. Note the finger cots on the ends of the pliers. Place the jewelry on the paper plate and spray with alcohol. Rip open your sterile pouch and remove forceps. The forceps are slightly bent to prevent the locking device from working, and a rubber band is placed on the handle to create a more gentle locking device. Be careful not to touch the ends that make contact with the skin. The sterile needle is now removed from its pouch by poking the blunt end of the needle through the protective paper. It is inspected for imperfections, then placed in the bacitracin on the plate for safekeeping. The ring closing pliers should be kept away from the tray the needle is on. This is the setup you should always start with, and should be repeated exactly the same way for every piercing performed. Remember, the whole setup is done with your latex gloves on. After setting up your equipment, you should change into a new pair of gloves to start your piercing.